2 years ago, some major changes in the treatment for venous diseases occurred. The technology became improved, and you will notice perhaps a renewed interest in venous diseases, and vein centers have begun to become quite prominent, not only in Richmond, but all over the United States. So we're going to talk about venous diseases today, how the blood gets out of the legs, and what happens if it doesn't, the other half of the circulation. Now, I want to introduce a term to you. It's called reflux. We all know about when the esophagus refluxes, and that hurts and causes problems. Well, the veins can reflux also. That is to say, the blood circulation in the legs, when the blood is trying to get uphill, if it refluxes back down, and we'll go over that in much more detail, that therein lies the problem of much of the venous issues that we have. It is called venous reflux. And over 25 million people at last estimate have the disease. And it also is a disease as we all age, our veins are subjected to gravity. And what happens to our veins is that they begin to stretch, like a lot of other things. And when the veins stretch, there are these little valves that we'll see pictures of in a moment that no longer are able to keep the blood going up the leg. And as a consequence, many of the problems of blood pooling and of the other problems that we're going to see shortly occur. So we'll talk a little about the anatomy now and the physiology of the leg. There are two systems of veins in our legs. The systems are, you can see this called the deep system of the femoral vein, and that's in gray. And then notice this red vessel called the superficial vein. So there are two systems parallel bringing blood up. The deep system carries most of the blood. You never see it. It's way inside the leg, right inside the bones. But underneath the skin, and perhaps if you rolled up your pant leg or your stocking and you could see these bluer veins running, that's the system that we're talking about. That's the superficial venous system. That's where, as we'll see, in this area right here, the reflux occurs. Blood starts coming back down the leg instead of going up the leg. Now, healthy veins have valves in them. These are little bicuspid, two pieces of valve tissue that open in one direction. When they open, blood starts to go from the foot to the heart. But when that column of blood gets heavy enough that that valve, that the blood would start to fall down because of gravity, the valve then, a competent valve, will then become like that, closed. So the blood is always encouraged to go up the leg. There's no way that the blood can come back down if the valves are competent. The main valve, as I mentioned, is located high up in the groin, where I pointed out to you before. And when that valve leaks, then we get this condition called reflux, blood going back down that superficial vein, and then varicose veins will begin to appear. Or the spider veins on the skin. Or even worse, if this condition goes on unchecked for long periods of time, people can even get ulcers, edema and swelling in their legs. Now let's talk a bit about reflux again, because this is really the crux of the problem. You can look at reflux in the veins like a waterfall. The blood is supposed to be going up the leg to return to the heart. I mean, after all, if the same amount of blood isn't returned from a leg that's pumped into it, over the course of a day, what would you expect would happen? It's going to collect a lot of fluid, and it's going to collect blood, and it's going to become very boggy and edematous. So the way we're designed, blood in, blood out, and it's got to be a neutral balance, otherwise something bad's going to happen. So this is the term reflux. If reflux occurs high up in the leg, in the groin, where that deep system is spilling over to the surface, then pressure begins to build up in that surface vein. This leads to more vein valve failures as the blood starts to come back down the leg the other vein valves can't hold it back. So gradually over time, this becomes a sequential failure of valves from the top of the groin all the way down to the ankle. And once that happens, we all know what varicose veins look like. These are these tortuous surface veins that were at one time under very little pressure and were really just underneath the skin minding their own little business. When they have had all this pressure for years and years and years, they become tortuous and boggy and inflamed and begin to hurt ultimately. This again shows you the vein valves, a normal valve opening in that direction. When a vein would start to become dilated as we age, or if we gained a lot of weight, or if we're during pregnancy, these vein walls will stretch and you can see the blood's going back down the leg the wrong way. And the same thing when a valve becomes damaged. Now, this is an example of varicose veins that we're talking about. In the old days, we really didn't have very much to offer people for this kind of problem except to strip them. And consequently, because it was such a gross operation, both for the patients who didn't care for it and it was a long recovery, and the surgeons who really didn't enjoy doing it anyway, no one liked it and it lost favor. So varicose veins have been gone for a long time in this country untreated, as have a lot of the other ramifications of venous problems. Now this is another problem that can happen in varicose veins, and that is ulcers can occur. Now I had a patient, this is a mannequin on one of my exam tables, and this is a patient's leg. He's a young man. He came in after having been in the hospital for a while, having this ulcer treated, and when we got it cleaned up a little bit and he came back to the office for his first post-operative visit, he stared at the mannequin and I stared at him and he stared at me, and that was his leg, honestly. This thing looks almost like that. And that is what a venous ulcer looks like. They occur on the inside of the leg near the ankle, and they can be terribly painful and very hard to heal. If any of you have ever gone through that experience where you've had these wraps on your legs and ace wraps and these other things called Una boots, you'll know what I'm talking. It's a very nasty problem to try to get healed. This is another little manifestation of increased venous pressure. Sometimes people get these sort of spider-looking breakouts on their ankle. It's just really the tip of the iceberg, of course. This says no one's going to particularly get into trouble for something like that. However, it's a signal to a physician that there's trouble brewing underneath the skin where there's a lot more pressure. Again, venous stasis can occur as an inflammation in the skin. You may have heard of the term dermatitis. It's very scaly. It leads to infection because there's breaks in the skin. These pores are wide open. The skin gets very hard and woody, and again, it's too much pressure coming back down the leg. The leg is not draining the blood out of it efficiently because of the broken valves. This is another example of a brown staining that occurs for the same reason. And then this is another example of a very nasty ulcer in another patient. You can imagine how painful those things are. Now here's the risk factors for this problem. As you can see, it occurs much more often in women. 72% of women is estimated to have some form of venous disease, as opposed to men, less than half of them. And age is a factor. As we age, as I mentioned, the veins walls will start to stretch. The valves no longer come together. They're not competent. Reflux occurs. It's much more common in women than men. Family history, if you've had a family member, mother or father primarily, that have had venous disease, you're going to be very much more likely to have that in your lifetime. Multiple pregnancies is another very big one. Obesity, and then standing. It's amazing the number of nurses, teachers, people who are professional people who stand during the day who will come into the office with venous problems. Now, the symptoms that people experience are very diverse, but there's a pattern to it, and the pattern is pressure symptoms. Look at this. People will describe a pain, a burning, a throbbing, a fatiguing. There's too much blood in the leg. It's pooling. The leg can't handle it. And there's all of these sort of subjective kind of symptoms that people will describe as an achy, heavy, fatiguing pain. Then on the other side is the things that we've seen. The leg swells, it becomes discolored, dermatitis sets in, cellulitis, and finally ulceration. It's at this point down here that venous disease can become very serious, and that's where dermatologists will come into play. Sometimes podiatrists see people with this, orthopedists will see it, family practice doctors will see it, and a lot of times then the common denominator is they get referred to the vein center, and then we can reduce the pressure, as I'll show you in some slides, that will help this whole negative pressure phenomenon. Well, let's talk about the treatment of this problem. Well, the goal of the treatment is to reduce this reflux of oxygen-poor blood. Now remember now, another very important principle. The arteries are bringing the blood down to the feet and all over the body and carrying all the healthy oxygen. It's the veins that are returning the blood that doesn't have any oxygen in it anymore. So in a sense, it's kind of like exhaust blood. It's been used up. It needs to be recirculated and renourished. That's the problem. We're recirculating oxygen-poor blood down the leg, and it's no wonder that the skin and the subcutaneous tissues don't want this kind of phenomenon to be happening. It's this loop of blood without oxygen causing high pressure in the skin that causes the varicose veins and all of the other manifestations that we've talked about. I've mentioned that the treatment that we used to do was to wrap legs, elevate legs, and then severe cases to strip legs. Now a new term has come into play, which is called ablation. And this is really where the excitement is in vein centers these days, is that we don't need to do gross radical surgery anymore to help people get over the subjective symptoms of these achy, heavy, fatiguing legs and also spare the skin. Ablation means basically to kind of seal the vein shut. If there was a way in someone who's got a very bad vein that's refluxing under the skin, rather than pulling it out, if there was a way to close it off, you would accomplish the same thing. You would reduce the reflux and reduce the backwards pressure phenomenon in the leg. I will talk about that in a moment. There is, of course, conservative management for varicose veins and venous disease. There's the ligation stripping procedure, the sclerotherapy in some cases where veins are better injected with medicine. I mentioned this term phlebectomy. That's where some people really don't have a whole lot of problems with reflux, but they have a few scattered veins in their legs that are tender. It might just be one big bulging vein in their leg. Well, there's a technique in the office just using numbing medicine to make a small little micro stab wound and pull that out. And that's because newer instruments have been developed that we can do that through a very small little stab wound. Catheter ablation. This is the kind of the newest treatment that we have for people who have gross reflux in their veins that are symptomatic enough to have something done about it. The two different types of ablation techniques are a laser method and then this other technique called the closure, which I have incorporated into my practice and will go in more detail with you what the closure procedure is. We don't do this anymore, for the most part, I would say. There are some surgeons probably that in some areas of the country that haven't been exposed to the closure technique or to a laser ablation, but for the most part, we don't put a wire through this vein and pull it out anymore under anesthesia. Some of you may have had sclerotherapy. A small little needle, like an acupuncture needle, is injected into these little cutaneous blood vessels. When I was in practice earlier, people would come to me and say, these things hurt. And I would say, no way do they hurt. How can that possibly hurt? And we were trained in vascular surgery as surgeons, we used to cut everything, that doesn't hurt. But these spider veins down in here, they don't project very well, but they will hurt, and they can hurt. And when you sclerose them, or if you decrease the pressure in the system, people will say that pain has gone away. And it's just one of the amazing things about this thing that I'm actually amazed every day about learning new things about the venous system that we were never taught. Now let's talk about the closure procedure, because that's where I'm getting kind of excited in my office with the results that we're having. The procedure, first of all, is a catheter. Like everything else in medicine now, there's a catheter involved. It's performed in the doctor's office, in our clinic, so that there's no hospital registration and nothing to go through all those kinds of things. I say it's painless to the extent that it only requires local anesthesia on a few parts of the thigh in order to accomplish the ablation. It takes about an hour, and most patients in a day or two or three, or certainly a week, say that the achy, heavy, boggy leg that they had beforehand, or even sharp pain that they would experience, and certainly the fatigue that they would get over the course of the day, that gets very much improved, if not completely corrected. What is the closure procedure? It's a catheter technique that is inserted through a small opening in the skin, and I have pictures of this in a moment, and using ultrasound, which is critical because once you've passed the catheter under the skin, you don't know where it is. So you need an ultrasound machine, and I have a technologist that assists me on all of these cases. So we can guide the catheter up the length of the leg into the point where that valve is that's failing, and then begin the ablation. Once the catheter is positioned, the tip of it is floured out to have 5 prongs touching the vein wall. Remember now, we're sealing this shut. Once that vein wall is opposed by these 5 prongs, radiofrequency energy is delivered to the inside of the vein, and when that energy hits the vein wall, it causes the lining of the vein wall to basically collapse and seal shut. It's heated to 200 degrees, which sounds terribly hot, but again, with proper anesthetic technique, local anesthesia, we can make this be that the patients don't feel this. And then finally, once the catheter is in the correct location, the heat is applied, it's simply just inched out of the leg very slowly, right out of where we inserted it near the knee, and along its path, it seals the vein shut. Once the vein is closed, people will say, well, gosh, where does the blood go? Well, there are hundreds of other vein avenues that blood will then find more normal, healthy drainage routes into the deep system and then be carried away from the skin. Remember, this is a drainage out of the leg. And we're reducing this waterfall, this reflux effect. If we shut that off, all the little ponds and lakes and streams that are in these varicose veins, they will dry up over time. Now, this is, I'll take you step by step through the procedure so you can see it visually. This is a thigh, and this is a knee, and we're going up towards the groin. Now, the vascular technologist has measured and marked on the skin where the vein is traveling underneath the skin. In a thin person, it's very shallow, and a deeper, heavier thigh person, it's quite deep. But the point is that you can see it with the ultrasound. Once the little sheath is in the leg, which is introduced after we've anesthetized that one spot, then we insert the catheter itself. And there's a picture of that in a moment. There's the local anesthetic technique. There's the sheath in the knee, and again, you don't feel that much. And now the catheter, once it's in the correct location and the heat is applied, it's just a simple matter of pulling that thing back out of the leg. This is a pre-treatment picture of a fellow who's got pretty bad varicose veins that ache and hurt, and his leg is swollen, and he's got these fatiguing symptoms. He's got a few of these spider outbreaks down here, and once the catheter was inserted here and the ablation performed, this is what you could expect. Now, this is a man that I did myself, and this was his left leg pre-treatment. The right leg, which we treated, was identical to this. That's really dramatic, isn't it? And this was about 2 weeks after we had done that. Now, we subsequently did that leg, and that leg's flat too. Another patient. Can you imagine having legs like that? And he was about 60-year-old man that worked in a warehouse. And his boss said to him when he wore shorts this summer, you'd better go and get this thing taken care of. We did the left leg first. And in fact, it's just a week or so ago that we had done him when this picture was taken because he still has fresh little wounds. But where'd they go? Isn't that amazing? People get leg pain, fatigue, and swelling from venous disease. And pre-treatment group, if you compare them to the results, 1 week, 6 weeks, and 2 years later, the data suggests that this is a very durable procedure that people get a lot of relief from. In summary, venous disease is very common. It increases with age as the vein walls stretch and the valves no longer hold the blood back. And it's estimated that 50% of us will get it at our age of 65 and up. Varicose veins and spider veins are what we see on the skin, but it's these subjective symptoms also that we discussed of the achy and the fatiguing legs that are dramatically affected by this procedure and helped. And it's the reflux phenomenon that we're correcting with the ablation. It's an effective procedure. More than 90% who have had it, and I've done about 400 of these now in my practice in 2 years. And I will say that with rare exception, people are very delighted with the outcome. We have had some failures, I will say that. Some people have had the ablation and the vein has reopened, and we've retreated, and the second shot at it cured them. Time for questions? Very good question. Tennis does not cause varicose veins in any way, shape, or form, or activity, athletics do not cause varicose veins. As a matter of fact, if you have a tendency to develop varicose veins, athletics and being active in exercise are one thing that would reduce the risk of getting it. That answers your first question. The second question, what do you expect after the procedure and how active you could be? We ask people to be as active as they can be after the procedure, so that one of the points on our instruction sheet for patients is to plan a walk for 30 minutes at least every day, to be normal, to have normal activity. The worst thing you can do is to dangle, because think about it, the blood's pooling in your legs. It's not moving, there's nothing helping it move away. And the best thing you can do is be as active as you can be. See, one of the things I didn't mention in the discussion, and it's an important point, and I started the talk out by saying, when I'm standing here, how does the blood get back? Well, in large part, it gets back by walking. If you walk, and if you be active, and if you be athletic, the muscles of the calf, and there's a little pump on the bottom of our foot, in the sole, that will begin to project the blood up against gravity. So being active, walking, is helping to promote healthy, active legs. Insurance, for the most part, will help us with this procedure and will cover all of it. Medicare has been very good to vein clinics as well, and they have recognized this as an important thing to do, and Medicare pays 100% of this. Okay, good. Thank you. Molly. Okay, thanks. I think I'll step out.